My name is Nick Moody. Welcome to the RAMPS study webinar. This is a recorded webinar for hospital leads and collaborators to familiarize yourself with the RAMPS study. I will go through a little bit about the RAMPS study, how it's administered centrally and both within each hospital. And then I will go through how REDCap works, which is our online data collection system. So as an introduction, I'm a vascular surgery registrar in the UK, and I'm running the RAMP study, which is an assessment of amputations, major lower limb amputations in sub-Saharan Africa. So as I said, this is the outline of what I'll go through during this presentation. So in terms of background, amputations we know have a huge and devastating impact on those who undergo them. They also have multi-specialty relevance. They cut across a number of different specialties because an amputation can be due to trauma, vascular disease, diabetes, may also be due to traditional bone setters, as well as many, many other causes. So they are a real condition which can act as a bellwether of how lots of medical and surgical conditions are treated or prevented. However, there is a huge knowledge gap in terms of our knowledge and understanding of amputations within sub-Saharan Africa. There aren't many studies which look at the outcomes or the causes of major lower limb amputation. The wisdom, the anecdotal evidence is that actually it's a lot of trauma. And our contention is that actually diabetes and peripheral vascular disease are causing much more pathology and leading to amputations than is being recognized. And as part of what I was saying about the lack of or the knowledge gap, there isn't really good prospective outcomes data on major lower limb amputations. There isn't really either good prospective etiology data on why people are having major lower limb amputations. So the RAMP study hopes to address some of these problems. The way it will work is that it will provide a snapshot of the causes, complications, and outcomes of major lower limb amputations. So any hospital in sub-Saharan Africa will be able to participate as long as they perform at least one major lower limb amputation per month on average. And by a lower limb amputation, we mean an amputation above the ankle. This includes patients of all ages who have amputations. We'll then follow them up for 30 days or until they leave the hospital and document the cause of their amputation and their course post-operatively. Anyone who takes part, whether that's as a country lead, hospital lead, or a collaborator helping to collect data, will be an author on the study, which will be published as a collaborative study. So everybody will be PubMed citable on the study. And from a research point of view, our primary research aims are to describe the in-hospital or 30-day mortality outcomes after major lower limb amputations. And our secondary aim is to understand why they occur and what the complications are. So in terms of the data we're going to capture preoperative demographic data, as well as comorbidities and the cause of amputations. Intraoperative data on the details of the amputation. So was it a below knee or a through knee or an above knee amputation? What kind of anesthesia was used? And postoperative data will include things like complications, whether they are systemic complications or stump complications, as well as in-hospital or 30-day outcomes. Which patients are eligible to take part in the study? So we will include patients of any age who undergo a major lower limb amputation. That includes a guillotine amputation. So people who have a damage control guillotine amputation and then a above knee or below knee amputation or a through knee amputation, they will all be included. We're including patients of any age, as I said earlier. If you are in a centre where you're unable to get ethical approval to include children, but you are able to get ethical approval to include adults, then we will include only the adults. Otherwise, we'll include both children and adults. And that's to help us try and understand the extent to which things like tumours contribute to major lower limb amputations in children. We're excluding minor amputations, so no toes, no transmetatarsal amputations, and we're excluding upper limb amputations. How is the study designed? So as I said earlier, we will start data collection in September, and data collection will last for 6 months. If you are going to start later than September because you're unable to get necessarily everything sorted before September, get your team together or get ethics, then we can start in October. You'll just carry on for 6 months. So we will start in September, and we will collect data on consecutive major lower limb amputations in each hospital. Now, each country has a country lead, which has taken part, and then within that country, each hospital has a hospital lead, and then collaborators are then part of that team. Hospitals can also have a hospital co-lead, and the reason for that is sometimes you need to divide the work, and also sometimes junior doctors or medical students as well are really keen to be co-leads and to drive the study forward, and so they can be a co-lead with support from a senior member of staff, a senior consultant perhaps, in each hospital. I'm really keen for that because it would mean that we can get more people involved at an earlier stage in their career in research, and they are then going to benefit from both participating in the research and understanding how it works, building a network of other surgeons throughout the region, and building international networks in the UK and elsewhere. So if you are a medical student and you're really keen to be part of the study and you want to be a collaborator, but you also want to drive the study forward in your hospital, then you are more than welcome to be a hospital co-lead if you can get someone on board who's a senior consultant in your hospital. The same if you're a junior doctor. Each hospital is anticipated will have a team of 5 people, a lead, a co-lead, and 3 collaborators. However, this is not fixed. I've had a number of hospitals that have asked, actually, we're a big hospital, we need more than 5 people because we do many amputations, or we have general surgery who do many amputations and then orthopedics who do many amputations, and it would be fine to have a team in each of these specialties. So 5 here and 5 here, for example. If you need more than 5 people in your study, you just need to contact me and let me know so I can make sure to include each person and to give them all the necessary logins. But this is how the study will work. And as I said, we will collect consecutive major lower limb amputations for 6 months. And hopefully we will get the requisite number of participants. The study won't change patient management, so it's essentially an audit of what's happening. Nothing will change in terms of what happens to patients' care. So where are we in terms of the RAMPS amputation study? We launched in January 2025, and since then we have been recruiting many hospitals and registering their interest in the study. And we're now at a stage in August 2025 where we are providing logins for each centre and for hospital leads for them to complete the necessary registration for their hospital. We'll then start data collection in September, although you can start, as I said, data collection a little bit later. So just an example of the country leads that we have. This is a list up to date as of August the 17th. These are all the country leads that have registered. This is a publicly available map, which is accessible through our website. And also I can send out to you if you're interested and you want to see who your country lead is. The country lead's responsibility is largely to disseminate the study in that country, but also to think about the necessary national ethical approvals that may be required in that country. to go forward and take those forward, and to be a point of contact for that country. Each of these people has been incredibly helpful and have managed to recruit many people within their country. If you see your country and it doesn't have a national lead, that is because no one has come forward. That doesn't mean there isn't people in the country who are doing the study. It just means no one's come forward. If you would like to be a country lead in your country, and there isn't one already, please just let me know. We can have a chat about it. And this is just an example of the registered sites. So we have had, I think, around 150 to 180 expressions of interest in this study, which is really great. And people are really keen to take part. The next step is to register the sites, and around 50 sites have now registered their teams and are ready to take part. So that means that the hospital lead, who has been sent a login for REDCap, has been able to log in and fill in all the required forms for the members of their team, so that each member of the team can get access to the REDCap system and collect the data. So as you can see, we've got great engagement in Ghana, in Ethiopia, and in Zambia, as well as in Uganda. There are some places that are slowly coming on board as well. Apologies. So what are the next steps for this study? If you're a hospital lead and you've had your REDCap login sent to you, please do log in and register your team. You should have had it sent through to your email, and the username will be your name or your second name .ramps. You can then reset your password if you're not able to remember or you can't see your password. If you would like to be a hospital lead and you're interested in the study, please contact us. If you are a collaborator and you have registered, you should receive a login for REDCap this week or next week, as well as a welcome pack. And if you'd like to participate in the study as a collaborator and you don't know what to do, you don't think your hospital is registered, please contact me and we will get you on board. So the next thing I want to do is talk about REDCap and how that works. I will first go through how it looks for a hospital lead and what they need to do, and then I will talk about how it will look for a collaborator and what they will need to do when you collect the data. REDCap is our online collection system. So to log into REDCap, you will receive a link, which you can also just Google, to get to REDCap. You'll then be sent your username, and then if you're not sure what your password is, then you can click on the forgotten password link just here. Otherwise, you can log in with the username and password that you have, and you'll come to a page like this, which says RAMPS site survey. So this, as I said, is for hospital leads. This is what your interface will look like. You'll click on this. That's the RAMPS site survey. And then if you want to register your hospital, then you go to add edit records, and you should only ever have to do this once. You add new record. And then this is your team registration, your site survey, and your approval upload. So to register your team, you click on this thing here. You put your name, your surname, and your ORCID ID. And it's really important you get your ORCID ID so that we can make sure that you're an author on the study. So this is really important. If you don't have an ORCID ID, you can register using the link there. And if you do, but you don't remember it, you can click on that link there. If you have a co-lead in your hospital, then you can put their name in here and their email address, as well as their ORCID ID. And then your team members will go in here. These are the team members for each hospital. Once you've completed that, then you go down here and you click on complete. And then you save and exit the form. let's just say ignore and leave record. So then if you go to dashboard, which is just there, you will see that it's gone green for team registration. That means that it's complete. But if you have put in your name and one team member, but you don't know who the second team member will be, or the third one, we've not worked that out yet, you can leave it as incomplete and save and exit. Ignore, dashboard, and now it's red, which means it's incomplete. So then you can come back to it later and complete it. So that's the team registration. For the site survey, you click on here, and this is a site survey which will help us understand the provision of pre-amputation and post-amputation care in each hospital. It's not very long. It should take less than 5 minutes to complete, and it just goes through things like your country, your hospital name, but also what kind of hospital it is, the number of beds, etc., etc. And as I said, it's not very long. And again, once you've done it, you click complete, you save and exit. Okay, dashboard, and then it's green. And then the last step is to upload any approval paperwork. So if you're going to get ethics approval because it's required in your hospital or your country, then you can upload it using this link here. We also need you to sign the data sharing agreement, which is you can download by clicking here and then upload by clicking there once you've signed it. And again, once that's done, you can change that to complete. Some countries require national ethical approval and some require local ethical approval, and which one you are depends. If you're not sure, just contact me and we can have a chat about it. For example, Uganda has national ethical approval and that's been obtained. Kenya is in the process. South Africa, it depends on which hospital you're in. But there is some approvals that are pending. In Ethiopia, it's all local approval that you require, and so on and so forth. The study itself has ethical approval from the University of Birmingham and from COSEXA already. So that's how it will look for hospital leads. Each hospital lead will have to do this once, and then once it's done, you can log out. You can also log back in and edit it later. So let's say I'm a hospital lead and I've registered my team, then I can log out here. Or if I want to see actually who's registered, there's a link here that you can see. This is a publicly available link. And you can see, put it in country order and have a look and see, okay, who's registered in which country. These, as I said earlier, these are all the hospitals that have registered their sites and completed everything and are ready to go. So if we log out now I'm going to log in as a collaborator, as a participant in the study, so a data collector. This is what it will look like. Sorry, ignore that page. So when you log in as a data collector, it will come to a page that says RAMPS data collection here. And then you click on that. And then now what you're trying to do is you're trying to add a patient who's had an amputation and you want to add their record to the study. So you go to add edit records, add a new record. And here you have the information. So the patient is 65, he's a male, his amputation happened today. He came into hospital yesterday. You don't know how many previous health facilities he visited. It was a traumatic injury that led to his amputation. Injury happened 2 days ago. It was a road traffic accident. Has the patient had a previous amputation? No. Does he have comorbidities? He's a smoker. And that's it. Was any imaging performed? Let's say no. If we say yes, then actually, okay, he had a CT angiogram. No, he had an X-ray. And then what is the urgency of the amputation? How quickly did you aim to perform the amputation? Even if you did it after a day, but you wanted to do it within 2 hours, then you put in urgent. What was the ASA score? It was, let's say, 2. He's got hypertension. He had a general anesthetic and he had a let's say he had a guillotine amputation. If you had a guillotine amputation, then it'll ask you, what was the completion amputation? If you don't know, because he's only had his guillotine today and he's going to come back for this later, then you leave it blank and fill it in later. If you say, okay, he's had a below knee, then you just could do that. So let's leave him with a guillotine. Who did the amputation? A consultant surgeon. And then that's it. So now we can pause because he's had the amputation today. We don't know what complications he's had. We don't know anything about post-operative details yet because he's only just had his amputation today. So we can leave it as incomplete. And then before we save and exit, we just need to check which number was he. He was number 7, so 15257. And then you save and exit. Okay, so then when you go to the dashboard, he's number 7, this one here. So you can see these are all the people that I filled in as an example who have had an amputation in this hospital over the last, say, month or whatever in the study. And he's number 7. So I need to remember that Mr. X was the amputation that had a guillotine amputation, number 7. So I need to keep a record of that somewhere, because then you're going to go back later and go to number 7 and say, okay, now he had a guillotine, and so now we've done a below knee amputation, and below knee amputation was today. And then let's say this is just before or when he went home, he had a wound infection and he needed to go back to theatre, and we changed to above knee amputation. He didn't have any other complications and he was discharged. Was he discharged against medical advice? No. And he went home today in a wheelchair. So now we're finished. We can click complete, save and exit. And so number 7 is now green. So when we go to our dashboard, you can see number 7 is green. So we've finished all of these apart from number 4, because he's still, or she is still waiting for some more data to be put in. When you have your login and you enter this data, everybody else in your hospital who's part of the study will also have access to these patients. So let's say I filled in, or my colleague filled in the details for number 4, and I want to come in. She put in that he's 66, she's female, had an amputation, etc., etc., etc. But now I want to come in and put in the post-operative details, and I want to say they didn't have any complications, but they have stump complications, but they did have an MI and they died today. So now I can complete it. So you'll have access to all of the amputations that are done in your hospital on your login, and then you can save and exit. Okay. Now, one question that someone asked me was, what if someone has an amputation and then during that same hospital admission, they have another amputation? So they go from a below knee to above knee. Is that a new data entry? And the answer is no, it's the same data entry. So patient has an amputation and then it's revised to an above knee amputation, then it's a complication. So you click here. If it's revised but to the same, so he goes from BKA to another BKA but a little bit shorter, then you click here. Then you follow them up for 30 days or until they go home. If they're still in hospital at 30 days, then that's when you put in this date. You don't need to follow them after that. If they go home after 4 days, then you don't need to, then you need to put in the post-operative details. Someone asked me, what if they go home and they come back after 1 week and they have another amputation? At that point, they are a new care episode, And so we will treat them as a new patient. So if this patient has a below knee amputation, for example, and then she went home and she came back and she had an above knee amputation, then you would add a new record and you would say above knee amputation. And here where it says, has she had a previous amputation? You would say yes, previous below knee amputation. And then do the same follow-up. You can save and exit. Okay. Record status dashboard. And there you can see, okay, all of our patients are now green, which is great. That should hopefully explain how the REDCap system works. I'm sure you have many other questions. If you do, please come back and let me know. You can, if you use the dashboard, you can look at all the list of the amputations that are in your hospital. You can also go to add edit records. And then you can select which one you want to edit, or you can add a new one. I hope that explains how REDCap works. Thank you for watching this webinar. If you have any questions, please email me or WhatsApp me or put it in the comments below and I'll try and reply to them either publicly or privately. And if you'd like to get involved, you're more than welcome to, particularly if you're in a country where we haven't yet started the RAMPS amputation study. We anticipate this will be a huge study. We already have lots and lots of interest and we want to really make it work. So thank you for being part of it.